to have you here. And today we have a very interesting webinar. This webinar is certainly going to throw a lot of light on interesting subjects, and it is being presented by a very extraordinary dentist, a remarkable person who has achieved through sheer willpower. So Maratha Mandal, Nathajirao ji, Halgekar Institute of Dental Sciences, Belagavi will present this interesting webinar. There is a saying, you are well dressed for the day, only wear a smile. Exactly. All of you are smile specialists, and that is why a very warm welcome to you. And we all like to see children smiling, isn't it? Well, that's because when children smile, we always have that de-stressing experience. On an average, it is said children smile 400 times a day, while happy people smile 40 to 50 times a day, and the average people like me, probably I smile only 20 times a day. But what type of smile do you sport? Well, here is Julia Roberts giving you some exciting smiles. But if you look closely, then you will find that there is a Duchenne smile, which is a authentic smile. This is the Duchenne smile, authentic smile, where you can observe that there is a crow's nest which has formed. So the University of California, Berkeley study examined the class photos of all the Mills College students. Some girls smiled genuinely, so that's a Duchenne smile, while the researchers tracked these women 30 years later, longitudinal study, they found the genuine smilers were blessed with better marriage, well-being, and career experiences. So definitely we should go to the dentist to get our smile correct, and we have to sport the Duchenne smile. So learn to make a Duchenne smile where there is a crow's nest, it is authentic. You will not be able to involuntarily make this smile. It is an involuntary smile. It cannot be made voluntarily. The Azadi Ka Amrit Mahotsav is an initiative of the government of India because we are commemorating 75 years of independence. And you will be surprised to note that Maratha Mandal, Belgaum started way back in 1931 to provide education base in North Karnataka. This Maratha Mandal Belgaum has 35 institutions in the field of education with 12,000 students. Currently, the chairman of this institution is chairperson is Rajshri and Halgekar. So they have all the dimensions. You can see the disciplines of art, science, commerce, professional courses in dental, engineering, pharmacy, polytechnic, etc. The Nathajirao Halgekar Institute of Dental Sciences, as per Dr. Ramakant sir, is there to educate students with state-of-the-art technologies and evidence-based dentistry. Belagavi, which has been proposed to be made the second capital of Karnataka, is very strategically located, has a smart city status with a very pleasant year-round climate. So you can consider doing any courses there at this Maratha Mandal's Belagavi campus. This is an educational hotspot. Belgaum sees not only Maratha Mandal but various other universities. So a lot of institutions dotting this place. Professor Dr. Chandrashekar Yavagal is an internationally acclaimed clinician. He is a PhD researcher on lasers, pediatric preventive and restorative dentistry, a university topper at BDS and MDS too. Dr. Chandrashekar has a diploma in orthodontics from Orthodontic World Institute. He is a fellow of the International College of Dentists, associate fellow of the World Clinical Laser Institute, and has a diplomate of the International College of Neuromuscular Orthodontics and Gnathology. That is the study of masticatory system. His post-PhD continued learning is in laser biophotonics. As a professor and head of the Maratha Mandal Dental College, Doctor has 75 publications in national and international peer-reviewed journals. Other posts which he holds: Vice President of the College for Light Medicine and Laser Therapy, Director of World Association for Laser Therapy, and he has many honors and achievements, feathers in his cap. One of the best dental educators. This award was given in 2019. He is the only dentist to have delivered a keynote address at the WALT conference in France. So the journey of India's first laserpreneur is very interesting. The chain of Novolace is also there under the banner of Laser Veda. He is a key opinion leader for global dental giants. He has recently promoted as the Vice President of the College of Light Medicine and Laser Therapy. He is the Chief Mentor of the Asian Academy of Laser Therapy and aspires to bring the World Congress to India. So, Group Pharmaceuticals is associated with the dentists for all their dental chairside procedures. For example, after any dental procedure, Cheyenne is a very interesting product. Bioactive glass technology from the UK. Elsense is another fluoridated bioactive glass that is rendering excellent protection from cavities and also sensitivity, discomfort, and pain. The pediatric dentist has an interesting option in Pediflor Kids with the bubblegum flavor and orange flavor. Freshclor is ideal for children too and any age group to render antimicrobial activity. This is the oral rinse and throat gargle. Recently, we have launched Densive, the denture cleanser with a patented color changing technology. And the world class manufacturing comes from our manufacturing facilities at Tarapur and also Bangalore with all the CGMP norms, WHO, Schedule M Part 2, ISO, and thus Group Pharma is a well trusted brand as a corporate too. And we are dedicated to CSR. So we do because healthy smiles matter. Now you can see this very interesting photograph where you can see the mahout who is pushing the adult elephant 6,800 grams. Basically, it is not the mahout who is doing it, but he is giving the confidence to his team member or uh, to the elephant that he can achieve. Well, Dr. Ramakant sir is such a very interesting personality who ensures that each and every team member in his team will perform at his very best. He encourages participation and also he encourages the development of his team and his institution. So I request Dr. Ramakant sir to address. Thank you very much. Dr. Ramakant sir, you are on. I think Dr. Ramakant sir is missing. 1 second, I'll just. There could be some issue with this audio or video. Okay. Dr. Ramakant sir, you can unmute yourself. Dr. Ramakant sir, please unmute yourself. You are made a presenter. You just have to unmute yourself.
Hello.
Yeah,
Hello.
yes,
Yeah.
sir. Yeah,
Yeah.
please
Yeah. Yeah.
speak, sir. Thank you.
Thank you, Mr. Sunil, and Jai Hind to all. Greetings from Maratha Mandal's Nathajirao Halgekar Institute of Dental Sciences and Center Belagavi. Uh, Warm welcome to all the participants and the registered delegates for this webinar. At the outset, I applaud the efforts of Mr. Sunil Chiplinkar and his entire team at Group Pharma for organizing webinars on topic of interest for the dental practitioners. Their team is contributing immensely in dissemination of current knowledge in the field of dentistry. So, kudos to Group Pharma for doing this excellent venture. Our star speaker from Maratha Mandal today, Dr. Chandrashekar Yavagal, Mr. Sunil has extensively read his biodata. He is the professor and head department of pediatric dentistry at our institute. More than anything, I regard him to be a very passionate teacher, and he is regarded to be a pioneer in the field of laser dentistry in India. He has been extensively propagating the knowledge and use of lasers amongst the practitioners. As we all know, the applications of lasers are numerous today. His topic of discussion today for this webinar is recent advances in teeth whitening. On behalf of my management, my chairperson, Ms. Rajshri Nagraj, and all my staff, I wish the team of Group Pharma all success in their endeavors. And we at Maratha Mandal are proud to be associated with Group Pharma in this venture. Thank you, Mr. Sunil. You can carry
Thank you.
it forward from here on.
Thank you very much, Dr. Nayak, sir. They were glowing words, very, very energizing. And now I request Dr. Yavagal, sir, to just put on his video. And Dr. Yavagal, sir, you can please put on your video.
Yes,
Yeah.
sir.
Yeah.
I hope
Okay.
I'm.
Yeah, you are very audible, sir. Everything is clear. Just before we start Dr. Yavagal sir's presentation, I will take just 2 minutes. There is a very interesting video which introduces Dr. Yavagal sir, which I will be playing. So I request audience to just watch this very interesting video.
This isn't just a 1,000-to-1 shot. This is a professional blood sport.
What is so important about driving faster than anyone else?
Box. Box.
Thank you, doctor. So over to you.
Thank you for that wonderful introduction. Jai Hind. It's an honor and an absolute pleasure to represent my parent institution, Maratha Mandal's Nathajirao Halgekar Institute of Dental Sciences, for this webinar being hosted by Group Pharma. So, respected principal, sir, Dr. Ramakant Nayak, the entire Group Pharma team, led by the dynamic Sunil Chiplunkar, have put in a lot of efforts to make this webinar possible on a weekday. It's a Monday, and seeing so many participants having logged in during their clinical hours is indeed testimony to the kind of hard work that has been put together by the entire Group Pharma team. It's always a pleasure to represent Maratha Mandal, and I'm a very proud faculty of that institute for the last 7 years and counting. So today I'll be talking a little about recent advances in teeth whitening, because that's a very popular topic amongst a lot of dentists. So can I start my presentation with your permission?
Yes, sir. Yes, sir. You are on.
Yeah, please go ahead, Chandrashekar.
Thank you, sir. I hope the screen is visible and the music is audible.
Yes, perfect.
Thank you. We nobody likes yellow, right? We all like white. And white is not a mere absence of any color. It is a shining and affirmative thing, as loud as red, as definitive as black. In fact, God paints in many colors, but he never paints so gorgeously as when he paints in white. This is a topic which is considered very simple, yet a lot of practicing dentists have issues offering a reliable and predictable teeth whitening service to their patients. So when I was given this topic for this webinar, I said, yes, why not? I mean, let me do justice to this very important, it's not very technically challenging or it's not rocket science per se, but yes, a lot of people find it very confusing when it comes to the kind of materials that are available for teeth whitening and how to handle the complications after the teeth whitening procedure in their patients. So here I am. Before I begin, a few disclosures. Since this is a topic that is based on several products, I'll be forced to showcase them in the presentation, but please be I want to be clear on this, that all those are being shown only for educational purposes. I do not endorse any of the products that I'm going to showcase in the presentation today. For a better understanding about the entire gamut of tooth whitening applications that are available in the market, I'll be using different products just to draw some analogies or to give some explanations on how different mechanisms and different molecules work when it comes to teeth whitening. So it doesn't mean that I'm endorsing any one of them. For the love of those pearly whites, right? We live in a country where a pizza reaches faster than an ambulance. We live in a country where we constantly get patients who have grossly decayed molars, but they are bothered about that one yellow dot on their central incisor. Now, what makes this white such an intriguing phenomenon, or what's the color psychology behind white? White has always been considered as cool and reserved. The color probably represents purity and has a very ethereal quality about itself. And think of a white bird flying above a plain of snow, a tinge of blue makes it a little easier on the eyes, and that explains the background that I have selected for this presentation today. Going further, white is clean and modern. White is considered peaceful, and that's the reason why it's no wonder that patients walk in and they want to walk out of a dental practice with pearly white smiles. And I have a small issue with Mr. Sunil Chiplunkar. You spoke about smiles, and you spoke about that study done by California University where they tracked these girls with beautiful smiles, and then 30 years down the line they followed them, and they were proved to be happy in life. I have a small issue with this. I think California University should have included their husbands also in the survey. I'll get in trouble for saying this if my wife has logged in. It's okay. Life is all about taking the right amount of risks. Have a look at this. When we see something like this, there are 2-3 things which immediately strike our mind. There was no dental chair there, and the person who was treating the patient is not even a registered dentist. Yes, you heard me right. There will be, these shranky looking teeth whitening or smile bars across malls in India very soon, because this has been registered as a cosmetic treatment, and you don't have to be a registered dentist to offer this. That's the reason why they are not even showing a dental chair in this video. In fact, the person who's treating the patient is not even a hygienist. Shocking, isn't it? Yes, it's true. Now, what product are they using? Now, they say that it is a patented product which they don't want to reveal the contents of, and the light that was used for 15 minutes supposedly does the magic. When we see something like this, and then when our patients walk into our operatories and expect something similar because they have seen this in a mall or somewhere else, there are 2-3 things which leave us confused. One is, how on earth can they do this without even using a dental chair? How on earth can they simply use any gel without understanding the concentration, without understanding the active ingredient? And how is it that in 15 minutes you get, these shiny white smiles? So let me demystify this to all of you. It's I feel our responsibility to make sure that a cosmetic procedure or an aesthetic teeth whitening procedure should be actually practiced by registered dentist and not by anybody who claims to be a smile makeover specialist. So the reason why this is happening is because teeth whitening is in demand, and unfortunately, a lot of dental practitioners are not very confident offering this as a reliable and predictable treatment modality to their patients, because there are certain myths that are making this entire teeth whitening phenomenon a mystery. It's actually a very, very simple thing. I'll try and demystify a lot of things today. I've been practicing teeth whitening for 17 years now. And then the first 3 or 4 years, I was just using different whitening products. And then I was introduced to the use of light-based teeth whitening. And now I do exclusive laser teeth whitening. So I'm going to trace my entire journey of 17 years, how I started with generic teeth whitening products and what has changed with time, why I felt that introduction of some kind of light is essential, and now what is it that I'm doing to make this procedure a very, very predictable one. Because I work with young clients, my clientele is very niche. I have to cater to the smile makeover needs of very young children, because I'm a pediatric dentist by profession. So why is it that patients seek whitening? They seek whitening for various reasons. It could be genetic reasons, tobacco-related stains, a tetracycline, or simply age-related ones. So basically, when we have to get started, this is what I follow. This is a procedural flow chart for any new patient who walks in with a certain chief complaint. We, by default, give a teeth whitening questionnaire to the patient and then do their intraoral examination. And by the time they are done with their chief complaint, they are also given the option of maybe enhancing their smile or changing the color of the teeth if they have opted for it in their questionnaire. So at least giving a teeth whitening questionnaire to every patient who's there in your waiting area is a very simple way of making them aware of their the condition of their oral cavity, and if they desire to have it enhanced, then we should respect that decision, right? So this is that teeth whitening questionnaire, and the first question is very, very important, and that is where the patient decides whether he or she is actually going to opt for this treatment or no. The first question says, are you happy with the color of your teeth? Now there are two options, but I like the third option. The first option says, yes, I'm happy with the color of my teeth. The second option says, no, I'm not happy with the color of my teeth. But the third one is very interesting. It says, I feel it could be better. I fall into that category. Being a dentist and being into dental practice for 17 years now, I always feel that yes, especially when I'm on a speaking assignment and I'm working closely with clients, I always feel I could be having a better shade on my enamel, right? So the next question is, what kind of color would you expect after tooth whitening? Because the patients and the doctors have to be on the same page, on the same platform when something like teeth whitening is contemplated upon or being offered as a treatment, because patients' expectations sometimes are very difficult to match. They could probably think of a whitewashed wall as being their white that they want for their enamel, whereas we as dentists know that it may not look that very natural. So it's very important that we understand what are the expectations of the patients. Then a thorough medical history is important, and a proper dental history. More importantly, the behavioral history as to how much tobacco or smoking, or how many glasses of dark coffee or cola they consume, and do they enjoy uh, consuming highly colored foods. And one more important thing, there are some patients who are comfortable with a teeth whitening procedure in the office. There are some others who would find it more comfortable to do it in the comforts of their residence. So do they opt for a whitening program at home, or do they like it to be done in the office? This is how we understand what is it that they are looking for, and then we offer them something which can suit their requirements. But then, like I told you, a proper medical history and a proper dental history, I would rather say a proper imaging history is extremely important, because when we look at this kind of a smile, it looks all nice and easy, right? Yellowish shade, and we look at it and then tell that there is some amount of hyperplasia, but yes, I can give you a good smile, and we rush to the procedure as such, which is a cardinal sin. You never know what could be hiding inside, right? And when you take a radiograph, you see that there is a demon hiding there. Correct? So don't rush into the procedure. I have learned this the hard way. So in doing this, so there is no role for rushing into this kind of a procedure just because the patient is getting engaged the next week or flying abroad in 3 days. It doesn't make any sense to rush, because ultimately they're going to blame us if there is any flare up or any complication after the procedure. So there is an absolute role for appropriate imaging before whitening, and this slide is self-explanatory as to why it is so, right? And then, like I told you, when it comes to offering something that is very niche, something that is want-based and not a need-based procedure. Now, how do you differentiate something that is want-based and need-based? See, patients want whitening. They need a root canal. That's the difference, right? I'll repeat that again for you. Patients want teeth whitening. They don't need it. On the other hand, there is, like I told you, we live in a country where a pizza reaches faster than an ambulance. We have walk-in patients who are not bothered about the sixes, who are which are grossly decayed. They are bothered about what's happening on the front of their central incisors. So it's very important that we, as practicing doctors and our patients, are on the same page when it comes to what is it that they are expecting. Have a look at these images: A, B, C, D, A, and F. In all these instances, what the patient means by whitening, or what the patient wants by whitening, and what we can offer are completely different. Especially, have a look at the image D. The patient expects that the four incisors in the upper anterior region will change the color as well. You and me know that that's not possible. That's ceramic out there. Look at the image on E. You see the crack line there? That's going to flare up terribly after whitening. B, bad candidate. Look at the lesions there on the cervical aspect. There, it's a bad candidate for teeth whitening. So it's very, very important, and very important to say no to a certain category of patients who want teeth whitening, but you and me know that there are other things which they need to get it done before they go ahead and get the whitening. These are typical examples of that. We should be very, very careful, because the kind of flare up that they might end up with, we may not be able to handle them. Again, a lot of people, their perception about whitening is different. They look at the image on K here, right? The lowermost one on the left side. They expect that even that will change its color and become white. We know that it's not possible. These are not absolute contraindications, but we need to tell the patients what is it that they expect when they meet that they want a smile makeover, when they want a proper whitening outcome for their clinical conditions, right? Image on G, the first one on the left hand upper side. Now, this can actually get worse after whitening because you see the hypoplasia there, you see the stain surrounding it. This may actually look completely etched after the whitening procedure. How do we reverse that and what do we do? We'll come to that a little later. But before you commit on offering something to the patients, be clear on what their expectations are. Then comes the $1 million question. After you and he or you and she have decided that teeth whitening has to be done, their $1 million question would be, doctor, how much can I expect my tooth shade to change? We generally use a shade guide, as you saw in the video, and we tell them that from here till here, but A2, A2.5, A3, it makes sense to us, not to the patient. What they are expecting, or rather how their brain is perceiving what is a good smile, may not actually be dependent on the Vita shade guide that we are using. So I found this very interesting way to do the baseline shade evaluation and then commit on what exactly the patient can expect. So please make a note of this. This is a $1 million suggestion. If the color of the patient's teeth is already whiter than the white of his or her eyeball, then that patient will never be satisfied, irrespective of how good or how effective your teeth whitening intervention was. I'll repeat that again for you. If the white of the patient's smile or the enamel is already whiter than the white of the patient's eyeball, this is the psychology based on which they pursue something to look good on them or no. This is not my logic or my philosophy. This is a philosophy based on what makes them happy when they match the color of the eyeball and the color of their teeth subconsciously. Even they are not aware of this. They stand in front of a mirror and they tell, no, I'm not happy with the color of my teeth. So in those instances, we can tell them that after teeth whitening, I will try and bring the color of your teeth closer to the white of your eyeball. Very, very objective way of putting things. They may not understand that on the cervical there is A3, I'll try to reduce that, and then in the middle there is A2. They may not understand that. What they understand based on how their subconscious brain thinks is based on a very interesting philosophy, a correlation between the white of the eyeball and white of their teeth, the shade of their teeth. If the shade of the teeth is already lighter than the shade of their eyeball, you do whatever you can. Even if you do veneers for them, they are going to look into the mirror and tell, no, I'm not looking good. So this is one very important thing. Please do a basic evaluation right at the beginning. If the patient's enamel shade is darker, just tell them, I'll try to bring it closer to the white of your eyeball. If it's the reverse, then that patient is not a good candidate for teeth whitening. Right? Informed consent is mandatory. We don't have time to go into each word of the consent. Somebody wants to take a screenshot, they are more than welcome to take it. But without a proper consent, please don't offer any whitening service. Right? Now let's understand the science behind teeth whitening. For achieving a good teeth whitening result, we need to understand the molecule. We need to understand the teeth whitening agent or the product that we are using, right? Now, as practicing doctors, we prescribe a certain medication. We prescribe a certain tablet, not based on the brand name. We understand the pharmacodynamics and the pharmacokinetics of the drug that it contains, and then based on our understanding about the pharmacology of that particular drug, we prescribe that to the patient and we tell them that this is what you need to take once in the morning, once in the afternoon, once at night, depending on their plasma half-life, depending on the enterohepatic first pass. There are so many things. We have spent 1 year of our dental school just understanding this aspect of the drugs. Then comes the brand name for those drugs, which we will be actually prescribing on the prescription pad. But when it comes to teeth whitening, we want a magical solution without even understanding what product we are using. What's the science behind whitening? What's the concentration of the molecule that we are using? We simply rely on the sales guys who come and tell you that my whitening gel is the best gel in the world. Perfect. And we expect and we believe them, and we expect that to give us a magical outcome. At the end of the procedure, the teeth may look a little white, but when the patient calls you back with terrible amounts of sensitivity, all your dreams get shattered at one go. This is what happens. We don't understand the science behind what we are using. We don't understand the chemistry of the molecule that we are using. We don't even realize how this is going to work. What's the concentration? That's where the teeth whitening process, which is actually very simple, becomes complicated, because we end up doing things which cannot be repaired, reversed. We could end up burning the soft tissues. We could end up causing pulpitis. We could end up causing so much of sensitivity that we start, or rather we draw ourselves into a shell and decide that, bus, I'm not going to offer this treatment to my patients anymore. The problem is not with the product. The problem is with the understanding of the way that molecule works when it interacts with a stain on the patient's tooth. Let me just make it very simple for you. Let's first start with the most common teeth whitening agent that is used in the world, that is hydrogen peroxide. Even I started my journey offering teeth whitening services using generic hydrogen peroxide based products. I had very little knowledge about them. Then I did a few mistakes. I learned from a few mistakes. Then I got myself extensively trained. Now I read the molecule or the ingredient of a teeth whitening gel as meticulously as I read the pharmacodynamics and kinetics of any drug that I'm prescribing to my patient, because they're similar to me. I need to know exactly when to give amoxicillin. I need to know exactly when I add clavulanic acid to it. I need to know exactly how much of amoxicillin clav my patient needs, based on the weight of the child. Only then I will decide what I have to prescribe, how many times a day, how many days the patient has to take this. Something similar kind of a homework I do with any whitening product that is available on my, or is made available on my table. And I suggest each one of you to do the same. So basically, starting with hydrogen peroxide, when peroxides break down into peroxide radicals, we end up getting an unpaired electron. We get, free radicals, we get unpaired electrons, and these unpaired electrons are very, very reactive. They are going to attack the carbon-to-carbon double bonds, which are actually responsible for the shade of the teeth getting darker. So the dark chromophore, as we call it, is because of the complicated carbon-to-carbon double bonds. So we need an unpaired, highly reactive electron which can break those carbon-to-carbon double bonds and give us smaller single C2C, single carbon-to-carbon moieties, which absorb less and reflect more light, thus giving a perception of whiteness. This is the chemistry behind whitening. So when I say peroxides, it's not a generic term. I mean, it could be viewed as a generic term, but you need to be very clear whether you are using a hydrogen peroxide or a carbamide peroxide. And today we are also going to talk beyond peroxides, where the world has moved when it comes to non-peroxide organic whitening, which we will be covering in the next half of this presentation. For the first 15 minutes, I think I've been given 40 to 60 minutes. The first 15 minutes, let me focus on what is available in the Indian market locally, and then move on to where the world is moving with respect to non-peroxide organic whitening. So I hope this part is clear, that we need a reactive unpaired electron, which is offered by peroxides once they break down into free radicals or peroxide radicals, right? So when we talk about whitening products, there is always a big list, horses for courses. Again, let me repeat this. I'm going to show you some products. I'm not endorsing them. I'm showing those products so that you understand exactly what that particular molecule represents. I'm not interested in the brand. I'm interested in the molecule that it contains, because I'm going to tailor make my strategy to suit a particular patient based on the molecule that I'm using. And I'm not going to be bothered about how big the brand is. So Here again, this is for educational purposes only. Let's start with something very common, which is available everywhere. Again, the first question that we need to decide is, are we going to offer in-office whitening or at-home whitening? So all of you know that at-home whitening is always offered through trays. Of course, there are a lot of products on Amazon these days which come with these Chinese lamps, which with different flashing colors. Please don't opt for those things. Please understand the science behind what actually works and what you need to be doing. So the first thing that we decide is, are we offering a in-office whitening or an at-home option? Generally, again, there are exceptions for everything. Generally, the in-office products are all based on high concentration hydrogen peroxide. Why is it so? I'm saying generally. Why is it so? Because you need to give a good result to the patient on the dental chair. You're going to use the shade guide that the operator gives you, or maybe your Vita shade guide, and then you have promised the patient that I'm going to get your shade from this to this. You need to deliver on what you have promised. And that's why you need a high concentration hydrogen peroxide for that. So in 20-30 minutes, you actually end up dehydrating the enamel. It looks a little whiter, especially with the gingival dam on, it looks a little better. The patient goes back, okay, satisfied, if not very happy. But the real problem starts when they call you back for sensitivity. Higher the concentration of hydrogen peroxide, higher the time that you have spent or that you have applied that gel on the enamel, higher is the risk of sensitivity. What's the chemistry behind sensitivity? I will come to that a little later. So if you want to avoid this, the next best option is to come one step lower, shift to carbamide peroxide based tray whitening procedures, but then they don't have the same amount of glamour that is associated with an in-office whitening procedure. These are glamorous procedures. The patient walks in and you see all kinds of advertorials where you walk in with this shade and you walk out with that shade. You promise the moon to the patient, but when it comes to delivering, you can't even take them to the treetop. And that's why a lot of dentists end up getting disappointed and they discard this modality because they cannot find a predictable, reliable product or strategy or a protocol to follow in majority of the patients. So long story short, in office, usually hydrogen peroxide, at home, usually carbamide peroxide. Now comes the concentration of each of those ingredients. Usually the in-office hydrogen peroxide products have something in the range of 30% HP to 40% hydrogen peroxide, 30 to 40. Right? There are other products less than this, there are other products more than this, but I'm just giving you a range. So the next time you decide to order something, please make sure that you understand the molecule. If you are using it for in-office, please understand what is the concentration of the HP that it contains or the hydrogen peroxide that it contains, right? So there are some products on this slide that you're seeing. Same way comes to carbamide peroxide when you're offering that to a patient with a customized tray. You think that it is all safe, but it is not, because you have no control once the patient leaves your operatory with the tray and the gel in the hand. You need to tell them whether they need to put the gel into the tray and use the tray for 30 minutes, 45 minutes, 15 minutes, 1 hour. Sometimes, even without proper instructions, they load the gel, carbamide peroxide gel, into the tray and they wear it overnight. Just because the dentist had read somewhere that there are certain products which have to be worn overnight. But those certain products cannot, the same logic cannot be followed with every product. Please read the concentration of the carbamide peroxide in that. The lesser the concentration of carbamide peroxide, the longer time the patient needs to wear that in his or her customized tray. Simple logic, right? Now comes a bigger confusion. A lot of people are confused as to what is this whole phenomena surrounding HP and CP. What is hydrogen peroxide? What is carbamide peroxide? For calculation's sake, for us to make things simple, any concentration of carbamide peroxide that you get will only yield 1/3 of hydrogen peroxide upon breakdown. I'll repeat that again. Any concentration of carbamide product when you're considering for tray-based whitening, you want to tell the patient for how long he or she needs to put that gel and wear the tray. You have to always divide the carbamide peroxide by 3, because only 1/3 of it will be the actual active yield of hydrogen peroxide from a carbamide peroxide product. So please don't get confused. If you see a label which says hydrogen peroxide, please see the concentration. That is the concentration of your final product that you are using. But if the label says carbamide peroxide, please divide the concentration by 3, because that will tell you the final yield of the hydrogen peroxide that you are going to get after using the product. And your usage time, or the time of usage that you prescribe to your patients, should depend on the final active concentration of the hydrogen peroxide. You cannot tell them wear it whenever you feel like wearing and then you blame the product for the damage that it produces. No. So please remember the example. You will not blindly write an antibiotic or an analgesic just by the brand. You will understand the molecule that is there inside, and then you're going to calculate the dose. You do your math, and then you prescribe that to the patient. Exact same thing has to be done with teeth whitening products also, right? Now comes the big question. First question was in office or at whitening. Choice is yours. I usually use a combination of in office and at home, because different countries have different policies. If you go to the US, it's almost bombarded by in office magic whitening kind of products. You come towards Europe, UK especially, you do not have a single product which is approved by the UK government or health society for in-office usage. It is entire UK it only endorses or allows tray-based whitening. So different regulations, different policies. So you go more towards the West, you have these magic options. 30 minutes you get 2 shades lighter, 3 shades lighter, 4 shades lighter, with light, with laser, without laser. So many permutations and combinations, but UK, it is exclusively tray-based whitening. So if you ask my opinion, I use a mix of both the strategies. I do a basic 15 to 20 minutes of in-office whitening, and then I offer the tray-based whitening also to my patients. Why? What's the logic behind this strategy is what I'll explain in the next 10 minutes. So first question, light or no light? Every laser brand or light brand will say light is needed. And every brand which offers a boiling high hydrogen peroxide concentration like 40% will tell you no light needed. So how will you read between the lines? Please understand this. You are bigger than the brand. You as a biologist, as a doctor, has to think what's the chemistry behind the product? What is the molecule that I'm using? Why is a company offering me 40% hydrogen peroxide and still saying that no light is needed? And if somebody tells me that light is needed, now when I say light, I'm talking about anything. It could be like a Zoom kind of a product. It could be like a Beyond Polus kind of a product. It could be like a laser whitening product. It could be anything. So the broad categorization of in-office whitenings are high concentration hydrogen peroxides and those hydrogen peroxides which are activated by using some kind of light. So the ones which are offering you very high concentration of hydrogen peroxide, like the one you are seeing on the screen, I'm not endorsing it. I'm not saying that the product is bad. I'm just trying to make you understand how do you read a whitening ingredient? How do you make sense of the molecule that it contains, right? So please don't make no mistakes. This is a beautiful product. I have done a research on this. It is published internationally. I'll come to that. So I'm neither endorsing this nor am I saying it is bad. What I'm trying to tell you is you be a wise decider on whether you will be using light or not using light. So when you're using something which is containing already such a high concentration of hydrogen peroxide, probably light may not be needed, probably. But let me give you the evidence for what the bottom line is. Literature has time and again proved that light is effective. This is an article from Journal of Dentistry. I can give you similar references from the British Dental Journal. Time and again, it has been proved that light is effective. Why? What's the logic behind this? Right? The logic behind this is very simple. For that, we need to understand what is a catalyst and how the whitening process happens. We have understood that peroxide will break down to peroxide radicals, which contain a highly reactive unpaired electron in its outermost shell, which is ultimately going to break the carbon to carbon double bonds and make them into smaller molecules, moieties, which will absorb less, reflect more. Thus, they give a perception about whiteness, right? Now, it's reasonable to assume that the more hydrogen peroxide concentration you use, the more will be the release of these radicals. It's not rocket science. We have learned this in our chemistry, correct? In our pre-university chemistry, we know this. You increase the concentration of a certain molecule. Obviously, if it is going to break down and give you free radicals or nascent oxygen, based on the concentration, the amount of nascent oxygen also will increase. The amount of radicals that you get will also increase. But will that increase the efficiency of those unpaired electrons which are acting on the stain molecule? No, it doesn't. The efficiency depends on how well the gel or the radical works on the stain molecule, how much the stain molecule absorbs the peroxide radical. That is not dependent on the number of radicals that are released. When you increase the concentration of the whitening gel, you are increasing the number of free radicals which have got unpaired highly reactive electrons in their outermost shell. That is not going to enhance the effect or absorption of those radicals by the stain molecule. So it is ultimately going to simply end up in more sensitivity, but not better whitening. Does this make sense? Increase in nascent oxygen, I've written that in red, does not automatically increase the affinity or binding of the nascent oxygen to the stain. That's the most important thing that is needed, because we have to ultimately break the carbon to carbon double bonds, right? By simply increasing, it's like we are having a problem in a certain area. You call in the army, you call in the reserve action force, they might come and reach the zone, but unless they fight with the culprits or the miscreants or the people responsible for the violence, you're not going to get a resolution for the problem. They will be simply there around, but they'll not be summoned to fight. They'll not be given the order to fight. The order to fight will only come when there is affinity between the peroxide radical and the carbon to carbon double bond, the stain molecule. And how do you increase that affinity? That affinity can only be enhanced by using energy, correct? There has to be an energy transfer. The gel that you are using has to absorb photons, has to absorb energy, and there has to be a phase transfer or an energy transfer from the photons to the gel, so that the peroxide radicals and the unreactive or the highly reactive unpaired electron in the outermost shell carries that energy to attack the stain. This is not rocket science. As clinicians, when we understand more complicated things in dentistry, this should be easy for us. But the problem is, this is not told to you by any product manufacturing company. Correct? Only a catalyst, energy in some form, heat, light, or a laser device can help in increasing that affinity. Simply by using a more concentrated peroxide gel is not going to give you more whitening. It is only going to give you more sensitivity. Why it is going to give you more sensitivity? Because that nascent oxygen that is released or the free radicals that are released, where will they go? If there are 10 stain molecules and there are 10 free radicals, those 10 free radicals will attack the 10 stains. You have simply used a high hydrogen peroxide concentration gel which has given you 100 free radicals. What will the other 90 do? 10 of them will attack the 10 stains. What will happen to the remaining 90? They'll keep moving up and down the odontoblastic tubules, giving you sensitivity. Simple. Did the whitening process get enhanced? No. Then why is it that you get a perception about a better whitening after a higher hydrogen concentration product? That's because of the dehydration that it causes, not because of the actual breakdown of the stain molecule. So this explains the chemistry behind whitening. This explains the chemistry behind why evidence has shown that some kind of light is always better. That's the Planck's constant for you, 6.626 into 10 raised to minus 34 joules per second. I don't want to thump my PhD thesis here. What I'm trying to tell you, no mumbo jumbo. Let's keep it simple. E equal to hc divided by lambda. Lambda is the wavelength in meters. E is the energy carried by one photon. So lesser the wavelength of the laser, higher will be the per energy or per photon energy that is carried. Correct? C is the speed of light. Now, when this photon hits the hydrogen peroxide gel, correct, it will transfer or dump that energy into the gel. The gel will get or use that phase transfer or energy transfer, and the unpaired electron, which is there in the outermost shell of that peroxide radical, will be having or will be enhanced because of this energy transfer, and that is the reason why it is able to break down the carbon to carbon double bond more efficiently. Simply, this is the logic behind why light has been proved effective. Now, which light you use, that depends on you, whether you are using a coherent light like laser or non-coherent light like an LED based thing, that's your choice. So the next time when you read an advertisement, please understand like a biologist, understand the chemistry behind it. Again, I'm not commenting on the product. It's a beautiful product. I'm not commenting on whether it should be used or not used. All I'm saying is read the ingredients. If it says 40% hydrogen peroxide and still no light needed, it should be read as 40% hydrogen peroxide. That is why light is not needed. Otherwise, you'll end up cooking the pulp. Because higher hydrogen peroxide will only give you more radicals. They will not enhance the affinity between the released radicals and the same molecule. The affinity will come from somewhere else. There has to be an energy to enhance the affinity. That energy could be heat, that energy could be light, that energy could be laser, right? So moving further, when we use a very high hydrogen peroxide concentration gel, what happens? You may not get a better whitening efficacy, but there are other things which go out of control. You get oral mucosal irritation, you get pulpal reactions, you get post-bleaching sensitivity, there is alteration in the characteristics of the enamel because you've used such a high concentration peroxide, right? If you are not careful, you might end up cooking the pulp. That's the reason why the pulpitis that creeps in, the sensitivity that happens. A lot of people are scared of offering this option for their patients. So let's understand the research, understand the evidence behind these protocols. See, that's the comparison between in situ and with bleaching, and deep longitudinal cavities through the enamel structure to a depth of about 200 microns. When you do a high magnification SEM, you can actually see how abrasive is the effect of a peroxide based bleaching. So basically, if you read this paper, which is published in Materials, new approach to determine the morphological and structural changes in the enamel as a consequences of dental bleaching, higher the concentration of hydrogen peroxide, you end up creating increased amounts of enamel porosities owing to the disruption of the matrix protein. Because of what? Because of, read there, through the free radical induced oxidation that could seriously affect the not just the enamel but the posterior bacterial colonization also. What do you mean by posterior bacterial colonization? If you, now I'm a pediatric dentist, for me managing or preventing caries is a big deal, because I want my young patients, my niche clientele, to come in happy and then enjoy their setting, and I don't want them to to come with deep dentinal caries for which I'll have to use other invasive modalities. So if I end up offering teeth whitening to them, yes, I do a lot of teeth whitening for young permanent teeth also. I'll give you more evidence on that. I don't want to end up creating a surface like this, which will actually help in the colonization of more Streptococcus mutans. I want the reverse of that. I want a surface which is nice and smooth, glossy, which can help me to better manage the or better prevent the colonization of S mutans. This is from the Journal of Aesthetic and Restorative Dentistry, effect of bleaching agents on the hardness and morphology of enamel. And this tells you what happens when you use hydrogen peroxide gel. One more paper on enamel matrix content changes after bleaching. What happens when you are using a high concentration peroxide product versus a low concentration peroxide product. The logic is very simple. If you use a low concentration hydrogen peroxide product, you may not get a desired result. But if you use a high concentration hydrogen peroxide product, the disadvantages outnumber the advantages, right? Moving quickly, buccal surfaces of the samples. This is a paper, the effect of carbamide peroxide on subsurface enamel structural changes and S mutans attachment, right? You can see here, this is from SDJ, and you will see here that pre-treatment and post-treatment, because there are changes in the surface of the enamel, there will be an increased incidence of S mutans attachment. That's a cardinal sin for a pediatric dentist. If I do something in the guise of offering an aesthetic outcome to my child patients or any patient for that matter, and if I end up creating porosities or roughness on their enamel or degrading their enamel so much that they end up colonizing more S mutans. It's a cardinal sin for me. So what do? That is one part of the story. The hard tissue effects, oral mucosal irritation. This is a liquid-based cytology study, effect of reservoirs on gingival inflammation after home dental bleaching. If any periodontists here, they'll understand the logic behind this. See, these are the normal aspect of the cells before bleaching. What happens when the epithelial and inflammatory cells immediately after bleaching, and what happens after the bleaching on the reservoir side of the tray. So they have correlated the gingival inflammation pre-peroxide and post-peroxide, and that's why soft tissue management becomes so important. If you are using a higher concentration hydrogen peroxide material, you will damage the soft tissues big time if you don't pay attention to this. Right? Again, one more paper, hydrogen peroxide based products after inflammatory and tissue damage, related proteins in the gingival clavicular fluid of healthy volunteers. This is the randomized trial, which was published in 2019, not a very old article. So this again says that there is a likelihood of a lot of soft tissue damage with peroxide based products. So basically, they have studied its effects on gingival fibroblasts, also on their proliferation, on their collagen production and fibronectin production. This is from Journal of Periodontology. I'm giving you more and more evidences and building the platform up for what comes as a surprise to the world. We are slowly but surely moving from the harsh effects of peroxide-based whitening to non-peroxide-based oxidative mechanisms, which we popularly call as organic whitening. So these are the reasons why the world is forced to look for alternatives to peroxide. If you are using a peroxide, I'm not discouraging you. I'll give you some protocols to decrease the side effects or the harmful effects of that peroxide when we come to that. But I'm just trying to make my case for why we need other alternatives. So the post-bleaching sensitivity, which we are actually bothered of, is a very, very small problem. It's the tip of the iceberg. The other problems that are actually hiding beneath the surface are far more important than the sensitivity. That's the reason why slowly but surely we have to use or think of using non-peroxide based whitening gels. This is from British Dental Journal, hydrogen peroxide tooth whitening products, review of adverse effects and safety issues. Beautiful read. If anyone is interested, they have compared everything in surgery, at home. In surgery is what they call in UK for in office, right? So they have compared 30% hydrogen peroxide with heat, without heat, 3 visits, 6 visits. Then at home, they have used 10% carbamide peroxide for 2 hours or overnight. They have compared 10% carbamide peroxide during the day or at night or overnight or 6 to 8 hours. They've exactly done the analysis and told us how much is safe, how much is not, right? So based on this and based on the pulpal reactions that it produces, this is Australian Dental Journal, safety issues related to the use of hydrogen peroxide. Please remember the penetration of bleaching agents occurs mainly as a result of their low molecular weight and their ability to denature proteins. That means what? You have zero control over the ionic movement. You think that you are only whitening the enamel or the dentine, but once it enters the dentine, you have zero control over how much the ions are going to penetrate. Higher the concentration of the ions, higher will be the side effects. You can actually end up causing irreversible damage to the dental pulp cells, as explained by this Australian Dental Journal study. So 10% and 30% hydrogen peroxide solutions can penetrate to the dental pulp within 15 minutes of application to the enamel surface. That is written in red. Please remember, 10 to 30% hydrogen peroxide. I'm not even talking about 35%, 40%. I'm only considering 10% to 30% hydrogen peroxide can penetrate to the dental pulp within 15 minutes of application to the enamel surface. So 15 minutes should be your cutout time, not what the manufacturer tells you. 15 minutes as a biologist, as a doctor, you need to understand that that's the cutout time for you, because here is the evidence for what I'm saying. Anything that you do above for 15 minutes is going to come back and haunt you. Either you move towards the world of organic bleaching, or I'll give you some strategies wherein you can continue to use hydrogen peroxide or carbamide peroxide based products and causing less damage by reducing the contact time with the enamel. Remember, 15 minutes, not more than 15 minutes, irrespective of what the manufacturer tells you. Don't promise the moon to the patient. It's okay if you don't give the desired shade that the patient wants, but let him be satisfied and happy with the new smile that he has got and not curse you for the damage that you are doing in the process. So now I'll give you the solutions for what you can do if you want to use the hydrogen peroxide product and then go to the organic bleaching. This is a 12-year-old male patient. Yes, all the pediatric dentists in the group can start jumping on their chair. What the hell has Yavagal done? 12-year-old male patient, and he has done in-office whitening. 1 second, I'll give you a bigger shock. I have used opalescence boost for this 40% hydrogen peroxide. So what did I end up doing? I'll give you the result. I used a 36 milliwatt light source, 36 milliwatt light source for just 4 minutes. So if opalescence boost 40% was supposed to be used for 20 minutes as per the manufacturer's instructions, just by using the right affinity to boost the electrons, I have brought down the application time from 20 minutes to 4 minutes. Correct? I have not changed the product. Used the strategy smartly to bring down the application's time so that the damage is less. This, in fact, was taken further, and we actually did calcium ion concentration with enamel solubility for different groups, post-bleaching, pre-CPP ACP, post-CPP ACP, and laser with ACP. We found the lowest calcium dissolution or solubility in the laser group, lowest depth of demineralization in the laser group, compared to what the same thing would have happened if we had not used it and left the gel for 20 minutes. We would be on the left-hand side of this graph. Just because we used a light source to enhance the activity and brought down the application time to 4 minutes, we are towards the right-hand side of the spectrum of this graph with the bare minimum depth of demineralization, which was further confirmed by polarized light microscopy also. Polarized light microscopy is considered as one of the gold standards for determining the damage after bleaching, and this is exactly what we did. The depth of damage was the lowest in the laser group, simply because the same product of 40% hydrogen peroxide was used for a lesser amount of time. We got the same result, but because of the enhancement by using the light source, we could cut down on the application time from 20 minutes to 4 minutes, and this was widely acknowledged, and this was published in the International Journal of Laser Dentistry. Enamel solubility and depth of demineralization with a low power laser bleaching and the impact of CPP ACP. Like I told you, there are many fancy products in the market. Please choose your whitening source wisely. Not all light sources are equal. Please understand, the light source could be anything. It could be a fancy Beyond
Dental and Health, the Beyond Polis Power Whitening System. The future of chairside power whitening has arrived. Feature packed with a built-in LED curing light, an intuitive control panel, and powerful light bridge whitening technology. The multi-directional lamp head allows for perfect positioning with every patient.
Anyways, that was not the point. The point is, I've been using Beyond Polis for more than a decade now. Happy with the product, but apples are apples, oranges are oranges. You cannot compare, a Chinese light bulb with a non-coherent Beyond with a coherent laser source. They're different things. When you are using a coherent source of light, your photochemical activation or the activity of the photons are going to be in one direction with one color of light, and the photons that make up that particular wave are in synchrony with each other. Correct? When you use the same whitening product, but the curing light or the light that you are using is a non-laser or using any kind of a fancy thing or one of those Chinese toys, you end up not getting the right results because the photons are there, but they are traveling in all different directions. There is no coherence, there is no collimation. So even if you are using an LED based device, at least look for a LED device which gives you polarized photons or polarized LED light. The first one is coherent light, which you can only get with lasers. The second best is a polarized LED. The third one is a Chinese toy. So you can pick up anything that suits your budget, but don't expect the results to to be the same. They will not be the same. You need to understand what's the quality of the photons that you are using in your light source for activating that particular whitening gel, right? So clinical whitening protocols, soft tissue management. If you want to do in-office whitening, soft tissue management is extremely important. You can choose whatever works for you. I prefer using the butterfly dam, which retracts the tongue, the cheeks, as well as the lips. Or you could use the cool dam, which you can use it like your flowable composite over the gingiva. Just make sure that 2 mm of the cervical gingiva and 1 mm of the cervical aspect of the tooth. So a 3 mm of bandage is very important. A soft tissue bandage is very important. Otherwise, the high concentration hydrogen peroxide can percolate through the gap and still etch the soft tissues. Our aim is not to etch the soft tissues. Our aim is to etch or not etch, rather, to whiten the mineral surface, the hard tissue, and not end up damaging the soft tissues, right? So this is how we do it. We do a basic prophylaxis first, and then we apply the cool dam, and then we light cure it. Please remember, cool dam, there is a method of applying it 2 mm on the cervical aspect of the gingiva and 1 mm on the tooth. We light cure that, and then we apply the high concentration hydrogen peroxide gel. You want to use the light or you don't want to use the light, it's your choice. But remember the study that I've shown you. If you leave that gel for more than 15 minutes, you are going to pay the price. You can't call up the manufacturer later and say that my patient came back with terrible amounts of sensitivity and the soft tissues are damaged for having followed your instructions. No, please understand the science behind it. If you want the same gel to be used with the same kind of outcome but no damage, then use a light source to activate it and bring down the application time, and don't cross 15 minutes at any cost, right? So some tips and tricks. Without using a light or a LED, what can you do? You can do what is called as the quant-sealed bleaching method, wherein the photons that are released, or rather the electrons that are released because of the peroxidation process, are not allowed to go out. You literally pack it. You can use your kitchen clean wrap for doing that, or you could use the tray. For that, you need to take the impressions of the patient or use a digital scan and get the BioStar tray ready before you do the in-office whitening. You put the gel, in-office gel, in the tray rather than putting it on the enamel directly and then make the patient wear that tray. The patient can actually sit in your waiting area and save on your chair side time. So you are doing something like an in-office, off the chair reception room whitening, if you want to call it. Same effect. It will give you the same effect. In fact, it will give you better effect. But remember the same thing. Don't leave the gel for more than 15 minutes. Call the patient and then wash it after that. Or you want to do it on the dental chair. Just make the patient seated and follow the same instructions that I've given you till now. Just wrap it with a clean wrap. The simple art of using a plastic cover to prevent the electrons from flowing out will enhance the affinity between the unpaired electron in the outermost shell of the peroxide radical and your stain molecule by many folds. This is called as the quant-sealed bleaching method. So this is a PhD level topic. There are so many techniques and tricks available to enhance the whitening without damaging the tooth. So the recent advancement is, the next 10 minutes is what I'm going to talk about. We are moving towards a non-destructive organic teeth whitening. Means what? The product will not contain peroxide at all. And how on earth will it give us the desired results? I'll explain the strategy. I'll explain the brilliant concept behind this. And we call this as the non-destructive, non-peroxide organic teeth whitening. And that's why the topic for the day has been kept as a recent advances in teeth whitening. See, there is this wonder molecule called thalidomidinocaproic acid, PAP. Thalidomidinocaproic acid is an organic peroxide. Just like we had an inorganic hydrogen peroxide, we have an organic peroxide which is called PAP, thalidomidinocaproic acid. This is very popular in the Europe, and it's being used as a non-peroxide, radical-free approach. This was published in the Dentistry Journal in 2021, December 2021, to be precise, a very recent study, which says that thalidomidinocaproic acid has got even better potential for oxidation. You don't need the release of peroxide radicals because this is not a peroxide-based product at all. This involves what we call it as epoxidation of molecules. And basically, epoxidation will again give us a breakdown of the conjugated double bonded carbon moieties, which was our main problem in the peroxide whitening also. The same carbon to carbon double bonds can be broken by using a non-peroxide based product which works on a process of epoxidation, right? So basically, There is no formation of free radicals as per the Bayer-Villiger oxidation reaction. This is the advantage of using a non-peroxide PAP gel. PAP stands for thalidoaminocaproic acid. Now, since there is no formation of free radicals, there is no question of postoperative sensitivity. Since there is no formation of free radicals, there is no question of gingival irritation. Since there is no question of gingival irritation, there is no need for a gingival barrier for this. How exciting is that? Right? So you can read this article, a radical-free approach to teeth whitening, and I'll share some of the exciting work that my group is doing on this, my lab is doing on this. First, let me start with the evidence for the enamel erosion. How do I say that this is better than hydrogen peroxide? I am nobody to claim that it is better than hydrogen peroxide. In fact, I still use carbamide peroxide in a different way. I'll tell that a little later. But this is my go-to material now because I've tried everything that is available on the market for the last 17 years, and I'm not convinced to use any product which is going to give me soft tissue damage or post-operative sensitivity. That's the reason why this comparison, especially between 6% hydrogen peroxide, 35% hydrogen peroxide, 35% carbamide peroxide, and my favorite organic whitening agent, PAP, rests my case. This tells us completely how effective this whole PAP phenomenon is. Baseline values, post-treatment with 6% hydrogen peroxide, post-treatment with 35% carbamide peroxide, 35% hydrogen peroxide, and the last group is the PAP group, right? Obviously, any guesses? All the three commercial bleaching products, that is the peroxide-based products, caused a reduction in the surface micro hardness. The worst was 35% hydrogen peroxide. You can read this. It was ranked the worst in the regard. Not my words. That's what the article says. For the PAP group, the Vickers surface micro hardness increased after treatment. How on earth is that possible? Because there is no free radical release. It's an organic teeth whitening gel. Right? Have a look at this. The color change. You really think that hydrogen peroxide gives a better result than PAP? Maybe initially, yes, you're right. What you can see on the red curve, that is taking a shoot soon after the application. The initial whitening or effect that you may get is better with hydrogen peroxide. The reason is you are dehydrating the tooth, not that it has broken the stain molecules. This is from a article from Composite Communications, a biosafety tooth whitening composite gel with novel thalamide peroxycaproic acid. So this is again an article which has compared head-to-head hydrogen peroxide with PAP. Maybe initially you will feel that hydrogen peroxide would give you a better result compared to PAP because PAP is an organic entity. It will not dehydrate the tooth. But the final outcome, you can see that the orange worm and the blue worm are ultimately reaching at the same point. Compare the A and the B, usage, days, and you ultimately see that though the red curve is going up fast, it is ultimately the blue one which is meeting the same point. So you end up creating whitening without a gingival barrier, without using any artificial substance, without using harsh peroxide radicals. This is the way forward, and this must be something that you would have heard of. This is creating a lot of buzz in the recent past. I keep getting emails, I keep getting posts. What is this 24K gold bleaching? What is this non-peroxide option? And is it compatible with lasers? Which laser do you recommend? And keep the brands aside. Like I told you, I'm not here to promote any brand, but I'll tell you what's the science behind adding a gold nanoparticle to PAP. This is for the first time that this has been introduced in India, and I'm amazed at the kind of their research that they have done behind adding the gold nanoparticle, because it works on a process called catalytic wet peroxide oxidation. This was actually done to enhance the effects of peroxide by adding a metal. Now, what this brand has done is that it has taken the cue from this, it has taken the gold nanoparticle from this, and instead of using a peroxide, it has added the gold nanoparticle into a PAP gel. How brilliant is that? So basically, this is from advances in nanobiotechnology, design, synthesis, and application of gold nanoparticles in teeth whitening process. The same thing has been done in the 24-karat gold PAP gel, which is very popular these days, called the gold bleach. The reason behind the gold nanoparticle is the CWPO phenomenon that I have given you the evidence for, and the choice of the metal being nano or being nano-sized gold particles is because of this atomic number of 79. And this atomic number of 79 on the periodic table gives us some idea into the effectiveness of that product when it shows an affinity with a near infrared wavelength, specifically 810 nanometer laser wavelength. You can use that without a laser also, but with the laser, this has been designed specifically with 810 nanometer wavelength, because remember, you can't mix and match things. You can't read fudged research and then use any gel with any light source. You cannot do that. Absorption is important, and I'm making it more obvious why I'm wearing this absorption thing today, because whatever gel you're using, whatever product you're using, it has to have the capacity to absorb the right photons. That is when you end up getting these kind of results. Just in 2 rounds. See here, even if we are not using the laser or the light source, we can leave this gel behind for 30 minutes. Whereas with hydrogen peroxide, our cutout time was only 15 minutes. Why? Because peroxide damages the repair after 15 minutes is what the studies have shown. But since we are not using peroxide in this, no gingival barrier is placed, and we can leave it up to 30 minutes also. And this is the effect of irradiating it with the right wavelength of light, which is 810, and why the electrons get excited when they absorb 810 based on the optical affinity of AU, that is 79 on the atomic number. When it is faced with 810 nanometer photons, how the outermost electron gets excited and how that energy transfer will give us excellent results in a matter of 15 minutes. These are the studies, or these are the few of the cases. PAP gel before and after. This is a young patient that I recently did, a teenager, before and after. 24K gold gel. Here I've used it with the tray. I'm not using laser for this. Still working. Why? Because I know that if I'm not using the laser, I extend the time of the 24K gold gel. I leave it on for 30 minutes. This was done in a satellite clinic, so I did not have my laser there. So I did it just with the tray. A young teenager. This is not mine. It was a case of our fellowship student from Kochi, Dr. Meena. And she showed me this, and I was amazed at this. I had never tried this 24K gold gel for walking bleach technique, but she is an endodontist. So she's tried this and she shared the pictures. And I'm thankful for her for having shared the pictures, because this showed us that we could use this very effectively for walking bleach technique also. I don't have the time to explain what is the walking bleach technique. Again, I always make sure that after the in-office bleaching, I always tell the patients that to undergo a slight maintenance regime with a tray-based option also. Again, I'm not endorsing any product. You can choose any tray-based product. Please read those numbers there in pink: 22%, 10%, 16%. So the time of usage of the tray with the gel should depend on the concentration of the material that you are using. Now, if you don't want to use the 24K gold, you can also use what is called as the misty ester. A misty ester is a carbamide peroxide based product, right? It's not an organic bleaching agent. That's the reason why it is more economical. You can treat more number of patients with this because you need just 1 drop. You can again use this. This has got that nice lavender color. That's why it's called as the misty ester. So the misty ester works even without the laser, and you can use it with the tray, and the patient has to wear it for just 10 minutes. That's it. 10 minutes, because we don't want the carbamide peroxide to overwork. Just 10 minutes of usage with the misty ester and you get amazing results. You can ask the patient to just use 1 drop on the reservoir side of the tray. This can be used even without a laser, right? Extended uses of the tray. The same tray I usually make my patients use the toothpaste, CPP, ACP, casein phosphopeptide, and amorphous calcium phosphate. I'm not bothered about whitening sensitivity anymore because I don't use any of those harsh hydrogen peroxide based products. But what I want is that I want my casein phosphopeptide and amorphous calcium phosphate to act as vitamins for my children's teeth, especially. How does amorphous calcium phosphate help in whitening? That's the current viewpoint, which I'm going to just touch for 2 minutes. Amorphous calcium phosphate clusters, when they're applied to teeth, they actually settle down and begin to crystallize. So essentially, what they do is that they give you a new coating of hydroxyapatite after the whitening. That's why when you add ACP to the protocol, after whitening, you ask the patient to use ACP at home, you actually end up getting a better luster on the enamel. You see the dull whitish appearance, it is white with peroxide, that's because it is dehydrated. In a few days, the color comes back to normal. That will not happen if you have used amorphous calcium phosphate, because you would have built a new coating of hydroxyapatite over the enamel that was whitened. So this is how you understand the concepts and use them in proper synergy. If you are still using the old hydrogen peroxide method, your CPP, ACP can help you in managing sensitivity. Also, we also need to give instructions to our patients what to avoid, because home care and maintenance regime is very important. Last point, last 2 to 3 minutes I'll take for telling you how to market laser whitening. See, marketing is everything with laser whitening, because whether you need not be doing laser whitening, you can be doing teeth whitening also without a laser source. But how you market it is extremely important. You could call it safe whitening, you could call it a smile spa appointment, you could call it as therapy for your bad breath or fresh breath therapy or whatever, the way you brand it, the way you market it becomes very important. I read this recently, somebody calls it as a 7-day detox smile. Some, fancy things, but yes, they are creating a brand for yourself, which is so important. You do the best whitening sitting in one corner, and if you don't market that, then the people will not come to know what's the difference between you as a level A practitioner with the others who are just doing generic over-the-counter things, right? You know what is happening with the aligner industry. A last word of caution. Any orthodontist here would endorse my viewpoint. What's happening with the aligner industry? The aligner industry is bypassing the clients. I mean, bypassing the dentist and directly hitting up on the clients, and then they are offering, the aligners to be delivered directly to the patients. I'm nobody to say whether it is right or wrong, but yes, it has taken the whole profession by storm. Are you sure that the same thing will not happen with teeth whitening? Have a look at this video, and this will change the way your and my perception is about teeth whitening. Sooner or later, it is going to hit us the same way as the aligner market has hit us. So before that, if we brand ourselves and if we reinvent ourselves and offer what our patients want, it will ensure that we are looking into a more lucrative future as dentists. Have a look at this. This is a shocking way of how
a beautiful smile leaves a lasting impression.
How the whitening industry is bypassing the dentist.
Photos, let's face it, many of us wish ours were better. Toothpaste and whitening strips give us inconsistent results, especially if your teeth aren't perfectly straight. For professional results, you'd easily spend hundreds of dollars and a trip to the dentist for a set of custom-fitted whitening trays. That is, until now. Introducing Smile Brilliant, the perfect solution for fast, affordable, and professional teeth whitening, all from the comfort of your own home. Where a dentist appointment can take weeks just to schedule, with Smile Brilliant, you'll receive your starter impression kit within 2 to 3 days after ordering online. Once you receive your kit, simply mix the putty, make your impressions, fill out the card, and place your trays in a prepaid envelope. In just 10 easy minutes, your impressions will be ready.
Can you beat that? She was mixing putty in a tray that is given to her, and she's taking her own impression and sending it to the company. Can you beat that? This is going to hit us as badly as the aligner market, if not worse than that. So basically, what we need to do as dentists is change our mindset. This is one of my favorite books, Rich Dad Poor Dad. I had a poor dad who was extremely rich by heart, so I miss him every single day. You can see him there in the background. But yes, there are some things which I don't want to teach my children, at least not my students. And I draw the similar analogy when I say the same logic works with a rich dentist versus a poor dentist kind of a concept. If you are using, say, anything like a laser, I'm not talking about laser science per se. Today, it's not a topic about lasers at all. But I'm just trying to tell you, what is it that you're offering your patients? If you're only offering generic cutting, generic root canals, generic crowns, generic implants, you will never rise above the ladder. When you do some laser-assisted endo, you take it one step higher. A laser-assisted implant, you take it 2 steps higher. You take it, something like teeth whitening. You don't have to use the laser, like I said. But if you create that brand and then value if your patients start valuing your services there, then you rise up this ladder, which I call it as the value ladder, right? There is no limit to this. I mean, if you are into laser practice, you will understand that we are now doing laser neurology and oncology also. That's not the point. The point here is you need to offer something which is not generic, which is very niche. And a teeth whitening protocol or a teeth whitening service at your practice can boost your image big time. And please be aware that this is going to hit in India very soon. What you saw in the video there. I mean, if the dentists are bypassed for the teeth whitening industry, same thing, the same kind of a result what we are seeing with aligners is going to hit us. Before that happens, let's become wise. Let's change our mindset and then give our patients what they want rather than what we wish to give them, right? So let's do some math on teeth whitening. This is very exciting. If we had the time, I would have actually done this live, but then I don't have time for that now. I've been given only 40 to 60 minutes. I think I have overshot on that. The numbers game. Let's say you're doing teeth whitening. You're charging, around 7,500 Indian rupees for one patient at your practice. Just giving you an example, just to tell you how much revenue it can generate for you, right? So you do 2 cases per week, just 2 cases per week. You end up generating a revenue of 15,000 per week. 4 weeks in a month. Now, I'm not so dumb to assume that all months will have 4 weeks, but to be on the more conservative side, let me calculate only 4 weeks. There are some months where we have 5 weeks, but I'm only calculating 4 weeks per month. So that would generate around 60,000 rupees every month. You do that for 12 months in a year, you generate around 7,20,000 rupees only by doing teeth whitening, by using simple, predictable, no nonsense approach. Just read the ingredient, understand the chemistry of the molecule that is there in it. Not all the whitening gels are equal. Not all of them need a laser. Not all of them need any light source. Your understanding is more important than the product or the brand that you are using. So choose wisely. How much revenue did you generate last month? This is from the rich dad versus the poor dad. This is my analogy of who's a rich dentist versus a poor dentist. If you have earned 50,000 rupees last month, but you wanted to earn 2 lakh, 2 lakh minus 50,000 is the price that you are paying for not becoming as skilled as possible, as soon as possible. $8 AP means as skilled as possible, as soon as possible, right? So that's the price that you're paying. And what skill am I talking of? Is this some rocket science that we need to go and learn? No, it's just a little change in the mindset, just a little out of box thinking, which can take us places. Like I said, even if you charge $3,000 from one customer, you can still reach $3,000 from charging $300 each from 10 customers, or $30 from 100 customers, or $3 from 1,000 customers. So choice is yours. Don't be scared about what your contemporaries will think or what the result will be like. Like I told you, it's very, very predictable. We have got amazing products today which are available. I'm not just talking about the non-peroxide ones. Even if you're using the peroxide ones, understand the molecule properly, understand how to prevent the damage to the surrounding tissues. And Mr. Sunil Chiplunkar told at the front that there are some wonderful products under their banner, Shy-NM and Elizens and Oragard, which can help us in managing the sensitivity. You can consider using them for your teeth whitening protocol also. Just make sure that you understand the science behind it rather than just following the masses. It was an absolute pleasure being here representing Maratha Mandal's Nathajirao Halgekar Institute of Dental Sciences, Belgavi. Once again, thank the organizers, Group Pharmaceuticals, for hosting us here today. And I don't know, Mr. Sunil, if I have any questions, if I have the time to take them, I'm ready, right? So if anyone wants any more details, I'm available, right? Thank you so much.
First of all, it was a fantabulous, energetic, and very vibrant talk. It was almost like a masterclass, I can say. So what I suggest, sir, that I will just pose 1 or 2 questions, and that will help. First of all, you have a lot of accolades. Dr. Krishna Prabhu is always saying that it is a pleasure to listen to Dr. Yavagal, sir. Dr. Amrita has also said, you make the topic so easy to understand. And Dikshit Raj has said, great to hear you again and again. Thanks a lot. The question which Dr. Krishna asks, what power is needed of 810 nanometers for 24K gold gel?
Fantastic. Only Krishna can ask such questions. He's a good friend of mine. That's why he's praising on the group. Krishna, to answer your question, depends on what strategy you are using. If you are using an 810 in a low power mode, even 300 milliwatt is good enough. If you are using the 300 milliwatt, probably you need to extend the time of application of the 24K gold gel, which we can achieve in 15 minutes. You may probably need a little longer if you're using a slightly low powered setting. On the other hand, if you have a surgical 810 with you or a class 4 810 with you, you can safely use it at 2 watts per tooth or 4 watts per quadrant. The protocol that I showed you has in fact used only 1 watt. So if you are using it for only 1 watt, 4 minutes is what you need to irradiate it per tooth. If you are using it at 4 watts, again 4 minutes, but not per tooth, per quadrant. So 1 watt, 4 watt are the two things. You can go up to 2 watts with a single tooth irradiation. But if you are using 2 watts, reduce the time from 4 minutes to 2 minutes. So basically we play with the power and the timing. Higher the power, lesser is the timing. Lesser the power, more is the timing.
So great, sir. Thank you. One last generic type of question. Dr. Rekha Shetty madam is asking, if the frontal tooth cap is slightly yellowish, what do you do?
I would advise them to go to a good prosthodontist and get it replaced, madam. I would rather happily refer that patient to you because, like I told you, ceramic or any other cap will not change its color after teeth whitening. In fact, that will become the odd one out. All the others will change the color and this will stand out. So if the patient is so particular about that one cap, I would rather advise him or her to get it replaced.
Yeah, perfect. So, sir, it has been a wonderful webinar, starting from the smile bar right up to hydrogen peroxide, carbamide, and now gold pap gel. You covered a whole gamut of things, and your explosive energy, right from wearing that absorption t-shirt, everything was relevant to what you have rendered today. It was brilliant. And like Dr. Anirban has said, brilliant topic, much more brilliant presentation. I think he wraps it up. So if Dr. Ramakant sir is there, I would invite Dr. Ramakant sir to just give a final word. Dr. Ramakant sir, are you free?
Sunil.
Yes, sir. Yes, please.
Hello. Yeah. So I could sit through the entire presentation without any disturbance from my office, basically. And it's always a pleasure to listen to Chandrashekar. I have been listening to a lot of his webinars and presentations, and so very well described. And the topic that he has taken up, I think, so elaborately he has presented and given various perspectives, the chemistry, the science behind the teeth whitening and how it's to be done, and not just to go blindly by what protocols are put into place by the manufacturers and so on. Okay, so having said that, I'm sure all the participants are more wiser, okay, than they were about 1.5 hours back as far as teeth whitening is concerned. And I'm sure the initiatives that you have taken, Mr. Sunil, go a long way in propagating this kind of correct information to all the participants. Okay, thank you so much. And Chandrashekar, well done. I'm proud of you. Okay, very well done. Thank you so much.
Thank you.
Thank you. Dr. Yavagal, sir, just to deviate, I don't want to disappoint the attendees. One last question. Can I take that, please? Dr. Siddharth Verma. He has said, if I have a scenario that only lateral is discolored or different teeth have different shades, how to proceed with the teeth whitening protocol?
Again, Siddharth, it depends on what the patient wants. If the patient wants an improvement, considering his or her current condition, you can offer teeth whitening. If they want the exact shade on each tooth to match, then I would suggest you go for a veneer kind of a rehab. If all that they want is a slight improvement in what they already have, you can offer them teeth whitening. But if they're very particular about matching each shade, like you've said, each tooth has got a different shade, and then you want to match the whole thing, I would advise you to probably go ahead with an entire more elaborate smile makeover by using veneers.
Yeah, thank you, Dr. Yavagal, sir. There is a saying, if it is important to you, you will find a way. If not, you will find an excuse. What I see is you don't take any excuses. That is a brilliant one. There is so much of success, focus in your every word, every action that you take reminds me of Neeraj Chopra, where he is focusing on giving his best. And your best, I can say the liner is poverty is not a handicap. Poor mindset is definitely amazing. Very good. It's inspiring to all the young dentists also out here. So you have done a great service to everybody. And on behalf of the entire team and also the college, it is my honor to just represent the speaker certificate duly signed by Dr. Ramakant sir. So thank you very much,
Thank you so
Dr. Chandrashekar sir. It has been
Thank you so
awesome.
much.
And
Thank you so much.
I take permission from everybody to close the webinar. Can I close, sir?
Sure.
Yeah.
Thank you.
Thank you. Thank you very much, everybody.